Good evening, everyone. Thank you all for listening to my presentation and joining in on this discussion board. My name is Hannah Nykirk. I am studying applied behavior analysis here at Ball State. I currently work at a local ABA clinic in my community that also provides mental health services, as well as physical therapy, occupational therapy, and speech therapy. I currently work in the one-on-one ABA area, as well as I lead a group ABA, and it's called SPOT. It's a very unique and awesome group ABA therapy that is specified to the clinic. Once I sit for my boards and pass, I would love to practice in a school setting, or I would love to oversee a group ABA program. I think it would be an awesome experience. So I currently do not have a lot of in-depth experience with behavior assessments. I am starting to become a bit more familiar with the different assessments as I furthered my clinical experience as well as my educational experience. I currently went through a work training regarding Dr. Hanley's PFA training, and it was a great educational experience. The clinic I currently work at, we have utilized this with a few clients, and we are now starting to implement it on a wider scale. What is an FBA? An FBA is a functional behavior assessment. There are a few different steps within this assessment. It starts with a BCBA reviewing any existing data upon the child's behavior, as well as interventions that were previously used if a child had attended another clinic, or if they attended school and there were any interventions that were implemented there. The BCBA will then interview parents or caregivers and or the child themselves regarding their behavior. Then the BCBA will observe the behavior in various environments and settings, and they'll collect ABC data. And so ABC data, essentially, I have a visual here. This is also in your welcome packets. So we're looking at A, the antecedent, which is what occurs immediately before the behavior. B, the behavior itself, and then C, the consequence. So, for example, the chart says the antecedent, Tom is cooking dinner. The behavior, Ethan jumps off the couch. What occurs right after that? Tom tells Ethan to stop. So this is the data essentially that BCBAs are going to be collecting regarding the problematic behavior. And then once the ABC data is collected, there is a hypothesis that is concluded and proposed, as well as various interventions to assist in decreasing the occurrence of the behavior. In addition, an FBA consists of concluding with a hypothesis about the relationship between the environmental stimuli and the specific behavior that the individual is exhibiting. When should an FBA be conducted? A functional behavior assessment should be conducted to determine the function of the behavior. That's what an FBA is specifically designed for. It should be used to identify the type of reinforcement that is maintaining a problem behavior in order to decrease the frequency of the problem behavior. In a sense, it is assessing the current reinforcer for the behavior. So understanding and treating the function of the behavior provides the best outcomes for the individual. What is a problem behavior? Problem behavior looks different depending on the situation. Overall, it is a behavior that is deemed problematic, and it's desired to see it decrease. This could look like a behavior that is prohibiting the individual from engaging in social interactions, prevents a child from going to school, or is putting themselves or others at risk. It's important that it is agreed upon with parents and professionals that the behavior is desired to see decrease. In addition, this problem behavior is defined operationally. We want to define behavior in a way that is measurable and observable, and that somebody can read the definition and understand what it would look like and be able to identify it. It's important that everybody is on the same page, including professionals and parents. What is the difference between an FA and an FBA? While they are similar, they're a little different. FBAs review existing data, interview parents, caregivers, teachers, individuals close with the child, and specifically, the problem behavior is observed by the behavior analyst, and the behavior analyst is recording those observations through the ABC data. When looking at an FA, functional analysis, the BCBA is testing the behavior to see what occurs. So it'll go through the 4 different functions: attention, access to tangibles, escape, and automatic reinforcement. Then each of these functions are tested to see what occurs. My current organization that I work at, we conduct FBAs. When clients first come into the clinic, we conduct an FBA, which includes interviews with parents and guardians, reviewing previous data, if there is any. Some clients that come to the clinic have attended other ABA centers or have come from school, and sometimes the children have not attended any ABA clinic or school, so there might not be a lot of data there. And then we collect ABC data for the first 3 weeks at the clinic before hypothesis is concluded and a behavior intervention plan is created. We currently do not conduct FAs. I'm not aware as to the reasoning behind this. I have not seen one nor heard of anyone conducting one at the clinic I currently work at. As previously shared, there is an FBA process that takes place specifically at the clinic that I'm employed at. 2 BCBAs will work with parents and their child for their first evaluation, which will take about 3 hours. We utilize Central Reach, which is an online data tool where we collect data, store data. This holds all of the interview information, past information regarding the client, ABC data, graphs of the behaviors, client's present information. We use it for a lot of things. And we also utilize tablets at the clinic to best store the information. So classmates, thank you for listening to my presentation. I wanted to bring up Dr. Hanley's PFA SBT for the discussion post. So essentially, the PFA stands for Practical Functional Assessment, aka a skills-based assessment. Have you ever heard of this before? Does your clinic implement or utilize this assessment? Do you like this assessment or do you disagree with aspects of the assessment? It is different. When I first learned about it, I was a bit skeptical of how this assessment would be beneficial to the clients and to the children, and Upon reading his articles and being educated through the training, I was delightfully surprised at how awesome and amazing this information was. So I'm looking forward to reading your responses in the discussion post.